Welcome to episode 44. Man, I think we do this in October. That's out there for the Yankee fans. Remember Mr. October, number 44, Reggie Jackson. So, anyway, today I want to introduce the newest member of the Ageless Forever team, Mr. T. Koo, Tuan Cool, PA. Tuan has been with us how long now?
It's been
6 weeks?
yeah, it's
Eight
about
weeks?
almost 2 months.
2 months almost, right? So he's got a great background in men's health, primarily with a urology background, and he's got some women's health from a different background. So, what we're going to let Tuan tell us about it. I'm going to kind of guide him a little bit because he's got a really cool story, I think. So, well, welcome.
Thank you.
Welcome to practice, but welcome to our podcast.
Thank you
We-
so
We've been
much.
threatening to do this for a minute, and,
Right.
and now we finally get to do it, right? So hopefully you don't get too camera shy. You don't run off, get
Hey.
scared, right?
Yeah, I got it.
So, all right, I know a little bit about your history, but tell us where were you born? Tell me about your journey,
Well,
right?
first off, thank you so much. I'm grateful to be here with Asia's Forever and being a part of this family and this community. And so I'm just so grateful, and I just want to let you know that. And thank you for letting me take a part of this.
Absolutely.
And I take a lot of pride because my parents, they were refugees from Vietnam, and so they took a huge risk by hopping on a boat, trying to make a life in America. And during that journey, I was born on a boat on my way to America, and they essentially said, "You're either gonna sink or swim." And
Literally.
and and thank goodness I chose to swim.
Yeah.
And so, I am so grateful that my parents gave me that opportunity. They took that risk for a better life, and so I seen the challenges they've been through,
Mhm.
just trying to make a life and just trying to maintain their health, wellness throughout that whole journey. And being immigrants, English is their second language, and so growing up, I kind of was the interpreter for them during healthcare and routine follow-ups and things like that,
Mhm.
with their own care. And so I kind of see the barriers and struggles that they went through, and their lack of understanding of health, wellness, and what to do and what not to do. And so throughout that, I kind of developed a passion for health, wellness, and I wanted to be in medicine. And so I'm so grateful that I'm here.
Very good. I
So
mean, it's a really unique background because I mentioned that to somebody who was Vietnamese. He said, well, he's got to be like at least this age because that was the last boat that came
yep.
over, and so I was like, yeah, well, it didn't, he doesn't look his age. We'll just say that. You guys can go do your own research and figure it out. So I won't throw you
Well,
under the
thank you,
bus,
thank you,
right?
thank you.
So, all right. So then you come here, go to school.
Yeah, so basically, when we first came to America, my parents, actually, that was my birth certificate was actually issued in Malaysia, and so I never lived in Malaysia, but that was where the birth certificate was actually issued, and so I had to maintain a dual citizenship throughout growing up in Tucson, Arizona.
Okay.
So, and then I
It's a
had,
long ways away from Malaysia
yeah. So
that you'd never been to.
well, well, so it's funny because my parents went to Minnesota first because they had some family members there that were trying to get them on their feet, but they decided very quickly that they didn't like the cold, so they chose the other extreme, which was the desert.
Okay.
And so that's where I grew up in Tucson, Arizona. Went to high school there, went to the University of Arizona, and then I came out to Henderson Toro University for my PA
Your
training.
PA training.
Yeah.
Okay.
So
And you went to school with my wife
yeah,
at some point
coincidentally.
in time. And it
Yeah,
seems
yeah,
like, right?
yeah. Small world.
Right. Yeah.
Yeah.
Yeah. Yeah. And then from PA school, what was your first kind of clinic that you worked in? What did you do?
Yeah, so throughout PA school, I knew I wanted to be hands on, and I just didn't want to be in the clinic all the time. And so I was actually very fortunate to land a job with urology right off the bat that offered clinic, hospital rounds, surgery, so you kind of get the whole picture and the course of the disease process
Hmm.
and care for the patient throughout that whole process,
Hmm.
acute care all the way to chronic care, um, all the way being into, assisting in complex surgeries and being able to get that experience it was invaluable. And so I spent 4 years doing that, and then I did 1 year of just straight surgical assisting everything from head to toe,
Okay.
craniotomies,
Like a
spine
first assist.
surgery, first assist, yeah.
Okay.
So everything in between, and then I went to Gyn Onc,
Hmm.
where I spent 7 years with an awesome surgeon, and she was an awesome mentor, taught me a lot. And so then ultimately, I went back to my roots, which was urology.
Urology.
So men's health has always been my thing, and so I pretty much know everything between men and women from the belt on the waist down, but don't ask me anything from above. So
Right. Right. So got a good exposure to female health through that gyne onc, but it's a different kind of hormone replacement, kind of probably a lot different than what you're learning here, and learning through the courses that you're going through to learn bioidentical hormone replacement therapy. A lot different than what you learned there, right?
absolutely,
Because there, all the stuff you're learning now was foreboding, right?
absolutely,
Can't give them estrogen, can't give them anything.
right.
Just you know, leave them suffer. Unfortunately, um, but I want to focus on more what you did in the urologic practice, right? Um, you got a lot of patients. What was the primary thing you were seeing them for?
So we saw basically full service general urology, but kind of like where my niche and my passion was with men health and wellness, erectile dysfunction, vitality,
Okay.
and so I kind of grew in that area and just kind of grew a passion for that, um, testosterone replacement, and then really the unique part was I was able to offer ED treatments in terms of not only the medications, the oral medications, but the intracorporeal injections, Trimex injections for men that are not successful with the oral medications,
Mm-hmm.
and then everything all the way up to the extreme of penile implants and being a part of those surgeries. And so just the whole gamut of treatment for ED.
Okay. So suffice it to say, you're a relative expert in erectile dysfunction therapy.
Yes, sir.
Right? Now, just wondering, um, did they use any modalities in office for erectile dysfunction, like corporal extracorporal shockwave therapy or anything like that at the urology clinic?
No, and that's the limitation with traditional medicine, and when it's not you know approved or the indication is not there for the insurance-based model,
Okay.
they don't offer those services like what we have here at Ageless.
The reason I ask is because I've been to some conferences, and the Androgen Society is one of the conferences I go to, and that's a mix, eclectic blend of endocrinologists and urologists and primary cares. And it seemed funny that the urologists would be in a group together and be talking about each other as, oh, is he a shocker or not? And that's what they kind of like. So, and they were almost poo pooing the guys that didn't do it. Were like, oh, it doesn't work. And the guys are doing it going, well, it does. That's why we do it.
Right.
Right. So it was kind of funny that there was a line almost drawn down the middle of those urologists
Right.
in that arena. So that's one of the things that we haven't offered here that we are offering now is the trimix, right? And so explain that a little bit. Explain what are some of the pitfalls, things that maybe patients don't know about it, concerns, things of that nature.
Yeah, absolutely. So most men who experience erectile dysfunction, the path of least resistance is, the well-known Viagra's and the Cialis. Um, First line, if that fails, the second line is to offer intracorporeal injections, which is a combination of compounded medications that is specifically compounded by the compounded pharmacy, and is it injectable medication that
Nope.
we teach and coach patients on how to do the injection in office to ensure proper procedures. And basically, that allows the patient to inject on demand when they're going to engage in sexual activity to increase, maintain, and have a better erection.
Okay. So we just kind of vaguely covered the injection, but where is that injection placed?
So it when you tell guys it's going to be an injection in the penis down there, nobody wants a needle down there anywhere, right? So the misconception is that it's at the tip. It's not. It's actually at the um, either at the base or the third
Kind of midway up the
midway
shaft.
up the shaft, and your penis is made of two cylinders called the corporal cavernosum, and it's two vessels, and literally it looks like that,
Hmm.
and you inject on one side, and then you actually switch the
The
next
next time.
time,
Yeah.
and so it's only one injection, and
And it's
so
a small insulin syringe,
correct, yeah,
right? Not a lot of medication,
right,
right? So it's probably more of a psychological issue,
absolutely,
right? Um, and I like the way that you present it because there are clinics that offer erectile dysfunction treatments, and their first line is this: they go to come in, we guarantee you an erection. I know that there's a clinic that wanted me to work with them when I first came out, and that was kind of their first line is we'll give you this test dose in the office, and you get an erection, and we can sell you this medication and an auto injector. And I was like, this is not right because you're not addressing the first step, or in my opinion, the second step. So you're not looking at their testosterone to see if they're deficient. You don't know if they've tried and or failed a PD five inhibitor. So how can you go directly to this? And it was just their business model. And I thought, I don't want any part of that business. And so knowing that you're going to address that with the patient, like, oh, we're going to make sure that hormonally you're dialed in. We'll try a 5-PDEI, right? We'll, if that fails, we have this, or we have, a non-invasive extracorporeal shockwave therapy. We have things that we can do. But if they elect to do uh, the intracavernosal injection, what are the potential issues?
So, first and foremost, you want to identify if they have any cardiac risk, right? And
Hmm.
so that would be one of the risk factors, and you kind of want to be cautious about that. And you want to be sure that if they are seeing a cardiologist, you want to be clear to administer that
Okay.
actual medication.
What
Just so
cardiac
that,
issues might they have that would be contraindicated for that?
so, cardiovascular disease, increased calcium score,
Okay.
elevated uncontrolled blood pressure,
Okay.
and so elevated stroke risk. So you don't want to increase their risk for their cardiovascular.
So it
So
increases blood pressure, the medication?
yeah, I mean,
Okay.
it increases your heart rate, and so
Okay.
um, definitely that's also something that you always want to just go over thoroughly, and you can't just have somebody walk through the door and just say, "Hey, here's
Here's
an
a test
auto
dose.
injector," right?
Yeah.
And then when you have an issue, go to the emergency room and call the urologist.
That's
Well,
exactly what they did.
and so that's what I appreciate with your model is it's truly integrative, right? So we're dialing in the testosterone, like you said, the hormones. We do offer the calcium score testing with our tiered memberships,
Mhm.
and so we're really looking at the whole picture and treating our patients as a whole package and not just
A symptom,
exactly. So
an erection,
exactly.
right? Um, so they inject the medication, they get an erection. People have seen the commercials on Viagra. If you get an erection that lasts longer than 4 hours, everybody's joke is, "I wish my erection would last longer than 4 hours." No, you don't, right? What can happen if you have an erection that lasts more than 4 hours?
So what can happen is basically you're gonna suffocate your muscle, the the two vessels that are engorged with blood, and over time, after 4 hours, that blood becomes deoxygenated, and you can get fibrosis, and you can get permanent erectile dysfunction damage, and that's an adverse effect. And
You infarct the penis,
correct,
right?
right?
So basically, he explained it well. That blood eventually loses its oxygen, and now it's just dead blood, and you infarct the penis, and so if there's no blood flow going down there, that aspect of that organ is dead. There's no other way to put it. It's you're not going to bring it back. And then if somebody, God forbid, had that, I think their only option then would be penile implant,
Yeah,
right?
yeah.
But if they get an erection that lasts longer than 4 hours, what would they do?
So, typically when I start intracorporeal injections on patients, I counsel them. I say never wait until 4 hours.
Mhm.
You know, I would say 90 minutes is kind of like the threshold. Unless you're a movie star and you're filming,
Right,
that's another story.
right.
But after 90 minutes, if you start to have pain, um, I prescribe Sudafed, maximum strength. So at the 90-minute mark, take a Sudafed. That should cause the erection to come down. If not, in 30 minutes, then you should proceed to the emergency room. And, I've been, on the emergency room side doing urologic care where we would have to, mitigate that and offer aspiration, possible surgery to evacuate that deoxygenated blood from the penis to decrease fibrosis and death of the penis.
So my thought on that is, and it's been some years since I've worked around hospitals, but for a time there was only two hospitals in town that had urology on call. One of them was UMC because of the level 1 trauma. Now Sunrise is considered a level 1 trauma, so they must have urology on call. And I think one of the St. Rose. But so what if it's one of our patients, and we give them the medication, they use the phenylephrine, it didn't work. Do we send them to a particular ER? Would you have them come in the office? Would you be able to do that procedure here? I just want, to pay people to feel comfortable. God forbid something happens. Hey, I'm in good hands.
Absolutely. So yes, I trained at UMC as well, and so yes, UMC is a level 1, and then Sunrise also has urology call. But actually, there's a few more facilities here in Vegas now, just because of the amount of urologists we have here that actually cover, and so there's a lot of urologic care in the emergency department. So, you know, God forbid one of our patients had that urologic emergency, the best route is to go to the emergency room, because when you get that kind of treatment, when you get to the point where it is priapism, you got to be on a heart monitor.
Okay.
Okay. And so it wouldn't be appropriate to do it in the office, and I wouldn't feel
Comfortable.
comfortable with having patients come here and giving them false hope that, hey, I can come to the office and this can take care of.
Right.
That's not the case. And so
See, that's why I asked the questions, because
Yeah.
I don't know.
absolutely.
Right. That's why I shied away from using that therapy,
Right.
because it was an issue that if I create the issue and I can't fix it, I don't want to do it. But with your expertise in that area, I think it's something that that we're offering now. And fortunately, we haven't really had any demand for it.
Right.
But if patients are interested in learning more about the intracorporeal injections, come and see Tuan. He'll give you a good education on it, and we can do some test dosing and see what works for you, and kind of get you on the road to improve healthier sex life if the other medications are failing. What else? Let's talk about, because I know little to nothing about it, but like it seems fascinating to me, but like the penile implant surgery. And I can see guys cringing right now, but like,
Oh yeah, I mean, you'd be surprised. It's we have everything in between, like a poorly controlled 40-year-old diabetic who has done everything in terms of, first, second line therapies, and they just are completely impotent. And then we have, the Hugh Hefners of the world, and there's a demand for
They're
it.
80 and still can't, and just, but
Exactly, they still
still
get.
want to function.
Absolutely.
Okay.
And so I've been involved with those surgeries. They're successful, and they give guys, that drive and that life and that feeling of just being alive again. And so just being able to have that option,
Hmm.
and then with the network that I have with my urology background, I have a good rapport with all the urologists here in town, and so
That do the procedure.
yeah, and
Yeah.
so if we need to get to that step, we have a referral line there.
So something that we just kind of learned a little bit about today was we had a request to offer a service, right? That we looked into.
Yeah.
Little Scrotox. And I used to I made a joke of it years ago. It was like, yeah, can you get the wrinkles out of my scrotum? Right. But now it's actually a treatment, right?
It is,
So
yeah.
we had a request for a patient who has hyperactive cremasteric muscle or cremasteric reflex. So using a little Botox in the scrotum, right? Kind of help relax the scrotum and to allow the testicles to hang a little further. We've used Botox intracavernosum injection also, um, because it's a vasodilator, because the smooth muscles in the penis, that Botox will relax them and improve blood flow to the penis. So it can be used for erectile dysfunction, but other people like it. You've heard the term, they're a grower and not shower. Well, this treatment can actually give that flaccid penis a little bit more volume. So for some reason, somebody wants that, uh, that is available as well. Um, we're not doing, so I know that this is going to lead to potentially another area that some people are doing. I'm not doing it yet. I don't know if you're interested in learning more, but you had seen it though just recently, where
Yeah.
somebody had filler,
Yeah,
right, to
one of our
improve the
patients.
girth.
Yeah, yeah. So, I was doing a PRP injection for the patient, and he had mentioned that he had a penile filler on his shaft, and so it was definitely noticeable, and that's something that I haven't encountered before, but
Hmm.
it's being done out there.
Yeah, it's maybe something we need to look a little deeper into. But I know that guys are using that to improve girth. So um, something that we're not offering yet. Um, but if I'll just leave it at this: if Tuan wants to go get the training and it's something that he wants to do, and we would offer it, because I'm all about doing stuff that's interesting, right? If you're
Brilliant.
interested in it, you
100%.
want to learn and grow and do something beautiful, right?
Absolutely.
And if you say no, I'm not interested in doing that, I don't want you doing it. Like, it's like I learned how to do Botox and all that stuff years ago, and I was really good at it. I learned how to do fillers. I was really good at it. I just didn't enjoy it. So I personally don't offer it. We offer it here at the clinic because we have a couple phenomenal injectors. One of them is my wife. Um, but they love what they do. And I think that's one of the keys. You have to have passion to do what you do well, right?
And that's why I'm so grateful that I'm here today with you and just being a part of this family, because you're allowing me to kind of let my passion come through and shine. And so I'm all about being hands on and offering the cutting edge stuff, and offering the best treatment for patients.
Yeah. And we'll kind of wrap it up, but like, you're doing testosterone replacement therapy in patients here. You did that at the urology clinic. Compare and contrast.
It's different, very different, and I'll be completely transparent and honest. There's a lot that I didn't do on the urology side, and that I'm seeing with the integrative medicine side, that the bioidentical hormone replacement therapy is a whole different world,
Hmm.
and that it almost felt like it was not taught to us on the urology side intentionally. And so, um, since I've been here for about 2 months now, you being so involved and just putting us through the proper training with World Link Medical, and just getting the proper bio hormone replacement therapy knowledge, and just opening my eyes to that whole world of, okay, this is how you do it properly, and this is what was thought, and now it's actually this. And
Hmm.
so being able to open my eyes, I'm still coachable. Every day I learn something new.
Hmm.
And so I'm able to absorb that, and keep an open mind, and just everything that's data backed. We do everything data backed, and it's just, that's the key there. It's nothing is trivial and or experimental, and so that's another thing that I admire about this model.
Yeah, I think we're able to nuance treatment a lot better than the medicine 2.0 conventional medical approach, whether it be through primary care, whether it be through urology or endocrinology. There are only certain ways that the insurance companies will pay these individuals to do the treatment. And so they limit themselves to those ways, and they don't open up their eyes and look at different modalities, different ways to improve testosterone levels, whether it be with direct testosterone replacement, whether it be with utilization of supplements, whether it be with um, selective estrogen receptor modulators, whether it be with luteinizing hormone mimickers. There's a plethora of different ways, and you can interchange some of these things as well. Uh, that's not taught there, and I don't know that it's not taught because it's not covered by the insurance entity, and you can actually do something for somebody in a much healthier, beneficial way than what is currently being offered, and yet they go, well, no, I'm not going to do that because I won't get paid for it. And I don't think that's a good model for medicine personally. But this way we're afforded well, the availability, the affordability to be nuanced and treat each individual as just that, and address their particular concerns so that we give them the best treatment. And if that treatment doesn't work as well as we would hope it would for that individual, we have a battery of other options. So you're not just stuck with a cookie cutter. There are clinics that just do, oh, we just do men's health. And you go, well, what's your men's health? Testosterone replacement. That's not men's health. That is a piece of it. It's a very important piece, but it isn't the whole thing. You want to look at the whole person and treat the particular areas. But man, if your testosterone level's low, but your vitamin D level's low, and you're obese and you're pre-diabetic, why not start working on those things? Taught maybe we use testosterone as a stopgap until we can improve your overall composition, and maybe your natural production will come back. Maybe we don't use testosterone because you're concerned about fertility and we want to maintain that fertility, and we utilize other modalities to improve your testosterone. But if you don't address the underlying health, the testosterone therapy won't work as well. And so, I think that's the rub here. Is it's more of a whole individual approach, right? Is to opposed to, oh, let me just go get my shot of testosterone that the clinic won't let me do at home on my own. I have to go there once a week, and oh yeah, they told me I need this other drug to block estradiol because estradiol is bad for men. Not according to any literature, but they sure want you to take it. Oh, and then they want to give me this other thing because they said, well, it's going to shut my testicles off and I want my testicles to keep working, but I'm 60 years old. So what benefit is that to me? We don't know, but you just don't want somebody who's going, here, everybody else got a happy meal. Here's your happy meal. And you don't even get a choice between apple slices or French fries. Everybody gets the same thing. You don't want that. You want somebody who's going to listen to you, evaluate you appropriately, and treat you to the degree that you deserve to be treated. And that's why I brought Tuan on, because he's all about that. And let's see what else. Oh, wait. like to do a lot of stuff with new technology too. You want to talk about a little bit of that, or you want to hold that for?
I mean, how much time do we have today?
We've
You
got,
know, I
we've
mean, I
got.
think we could touch on it a little bit, and we can definitely do a whole dedicated episode on that. I think there's a lot of new exciting things that are coming up, and we're really on the forefront, and we're on the cutting edge, and especially with the integrative medicine space, and especially here in Las Vegas, there's not a whole lot of people that are delving into this, and I think we're onto something.
Yeah, it's basically, real short and dirty. We're looking at AI to help improve our patient experience, improve our quality, not to make diagnoses, not to make treatment recommendations. We're using it as the tool that it was intended to be. It is not intended to replace anybody. It's there as a tool to improve everything for you, the individual patient. And so we're looking to implement that in the clinic. And we slowly are. It says we're using it as a scribe right now, and going to task it with doing a little bit more as we progress. Anything else you want to
No,
offer?
I think that was a good platform
Intro?
intro, and excited to do more.
All right. Well, thank you for joining us, and come in see Tuan here at 6020 South Rainbow, or give us a call 702-838-1994. Make an appointment to come see Tuan, and have him help you with anything that you need regarding men's health. He's also going to be getting involved in women's health, but we got to start with the easy. We're the easy creatures. You women, love you. We can't live without you, but you are more complex, not complicated, complex. And we love our female patients and that complexity because it really keeps us on our toes. But he's not ready for that yet. And this is a guy who's got 3 daughters at home and a wife. He's surrounded by estrogen,
Yes.
but he's got to learn the basics. And once we get him spun up, he's going to be awesome. So thank you for joining us.
Thank you so much.